So I'd like to call the meeting to order. We have a quorum. Again, I just reiterate, public comment was last week. Doctors are now deliberating on the idea of having a mask ordinance for the city of Nashua. Bobby, would you like to give some of the statistics that you brought?
So what I'll do is I'll just give a quick situational update to where we are with regards to Greater Nashua cases. So right now in Nashua, we continue to be at substantial transmission. We have a total number of 535 active cases. Our new infection rate per 100,000 is at 1,246. And Nashua's test positivity rate is at 15.7%. We do have a total number of deaths since this pandemic began of 109. And in our Greater Nashua region, and the reason why this information is important is because we have a great deal of resources here in Nashua with our businesses, our restaurants, and our hospitals. The substantial transmission is evident in Greater Nashua as well. Total number of active cases, and it does not include Manchester or Nashua's numbers, is at 1,186. New infections per 100,000 is at 1,151.6. And the test positivity rate for the Greater Nashua area is at 14.6%. The total number of deaths that have been experienced in Greater Nashua is at 223. The two significant numbers that we look as far as metrics on measuring the severity of or the impact of what we're seeing with COVID is in the number of new infections per 100,000 as well as the test positivity rate. And both of those are substantially high. New infections per 100,000, we like to see that number under 100. And our test positivity rate, we like to see that under 5%. And we have not seen those numbers for a period of time right now. Let's see. So that's the data that I have, Tony, for that. Other information that I did want to share, we've had an update in the total number of cases we've seen in our schools, 142 for the past week, 12/6 through 12/10. We had 470 cases in the month of November, and for those between the ages of 0 to 19, 525 cases in total in November. And we have 9 schools that are reporting outbreaks. The Omicron variant, we've had a case identified in New Hampshire. We have also learned that Omicron can cause more breakthrough infections. Vaccinations are expected to protect against severe and long-term symptoms, as well as the booster will help. Our current vaccination rate in Nashua is at 52.8% of those fully vaccinated and 59.2% of those who have received at least one dose. In our Greater Nashua area, our vaccination rate is at 52.7% of those that are fully vaccinated and 59% of those that have received at least one dose. Now, we've talked about the importance of vaccination, and if we can get our vaccination rate up to a substantial number, then we should also see a decrease in the number of cases that we're seeing. But since our vaccination rate still needs to be much more improved, we're seeing that the substantial transmission in our community is impacted by this lower vaccination rate. So those are the updates that I did want to present as far as statistical or data that shows the severity of where we are right now. Since November, we've had a 9% increase in cases, or I should say since Thanksgiving, a 9% increase in infections in Nashua and a 19% increase in infections since Thanksgiving in the state.
Thank you, Bob. Chuck, would you like to anything?
Well, I would echo Director Bagley's comments. I think the focus for me is the stats that I was looking at. Since September, there's been over 2 million new cases in kids alone. And this is the 18th week in a row we've had greater than 100,000 new cases. And so, again, as we addressed last week, we all like to be number one, but New Hampshire and Rhode Island are leading the country in this, and we have an opportunity to show the public, which is our mandate here as a public health forum and a board of health, that we're apolitical. This is not a right or wrong, as Director Bagley said last week. We're not trying to win anything. We're just trying to defeat a terrible, nasty disease. And the pillars of prevention include the social distancing, hand washing, vaccines, which are now taking off in kids, and masks. And it's been shown now for almost 2 years that the masks work. And that's why I'm very nervous that we need to get this going sooner rather than later, and that's why we're meeting.
Thank you. Stephanie, any comments that you might have?
Yeah, thank you so much, Dr. Storrs. So just to frame things, last week we met and as has been stated, devoted the meeting to consider whether the public health concerns necessitated consideration of reinstating the mask mandate. And the majority of the meeting, as was pointed out, was devoted to us listening to our Nashua community and to understand the information on which they were basing their opposition or support to the mask mandate. And we agreed at that time that because we wanted to make any recommendation based on the best available scientific information, based on the trajectory of the Delta virus after the recent Thanksgiving holiday, and based on the emerging information about the new Omicron variant, we decided to continue our discussions today, and also to include the current science of masks and vaccines, the interplay of these in any known or proven alternatives or additional preventative measures. And we know that in the intervening weeks, we've heard from constituents who favor a mask mandate and those who are opposed. We've had recommendations for no mask mandate can you hear me okay, Bobby?
Yeah.
Okay. For no mask mandate, a time-limited mask mandate, an indefinite mask mandate, and a mandate that's tied to pandemic metrics, which are something that are much more established than they were when we had our prior mask mandate. Dr. Capetta has given some statistics. Here are some more. And these statistics are from yesterday and compare the change over the prior 2 weeks. Nationwide, COVID cases are up 47%. Hospitalizations are up 21%. Deaths are up 40%. There were over 20 people who died just yesterday from COVID. And as has been pointed out, New Hampshire leads the country in cases per capita. Gene sequencing has shown that Omicron variant has arrived in New Hampshire. And we have verified that COVID-19 tests do not cross-react with either the flu virus or the common cold, even in the face of the Omicron variant. So a positive test means COVID. To date, 799,000 Americans have died of COVID, and many more have been left with disabilities due to the ravages of serious COVID infection. We also have more information about our hospitals. Our hospitals are over capacity. They have had to not plan to stand up temporary ICU beds, but they have had to stand up temporary ICU beds, facing significant staffing shortages, so much so that our own Governor Sununu activated the National Guard to assist hospitals in providing care. Multiple scientific analyses show that we are headed for a tidal wave of illness and hospitalizations due to a triple threat. We have widespread Delta variant, which we know is very virulent. We know that flu season is going to be bad this year because people were isolating much more last year, and we did not have very much flu, and that the Omicron variant is much more contagious than even Delta. And the strain on our healthcare system, which puts us all at risk, is does not take into account the statistics that I've mentioned, do not take into account the fact that we have seen and continue to expect to see an uptick in non-COVID illness due to pandemic delays in care and in preventative measures. We know a little bit more about Omicron. We know it's much more contagious. There is some preliminary data that it may be less deadly, but it can still cause misery and death, as well as long-haul COVID symptoms. And although the percentage of people who become severely ill and die from the Omicron variant may be smaller than that of the Delta, a small number of an enormous number is still a big number for our doctors, our nurses, and our hospitals. We know that in the past week that there has been a 7-fold increase in Omicron in the United States. And in the UK, where it got started earlier than with us, it has been doubling every 2 to 3 days. And they are expecting that by the end of the month, it will be the predominant variant. So while there are some promising treatments on the horizon, for those who are unfortunate enough to get sick from the COVID, the current situation is an important example of an ounce of prevention worth a pound of cure in terms of illness and misery, short and long-term disability, and the cost to businesses of sick staff and sick patrons that can't arrive. And at present, we only have 2 effective preventative means of bending this curve and avoiding what happened last year in Italy, which is well documented, where they ran out of oxygen and they ran out of ventilators and they ran out of other life-saving treatments and care, and people died. Those 2 measures are vaccines and masks. We now know that vaccines are safe and remain effective, very effective, in fact, in preventing hospitalization and death. Unfortunately, as pointed out by Director Bagley, we have less than 60% of people that have even had 1 vaccine. Many of the people who have been vaccinated were vaccinated more than 6 months ago, and we know that the protection wanes. Children were only recently approved to be vaccinated. Getting a booster or completing the series for most children is not something that will happen before the holidays, before Christmas and New Year's. So much has been written about the effectiveness of masks and our understanding in their role in preventing serious illness in the wearer and in reducing spread in the community and in the schools. And in particular, this understanding of how mask works has evolved since the beginning of the pandemic. Now, within the last several days, the Board of Aldermen and the Board of Health have received emails from community members citing an analysis by the CDC and the Morbidity or Mortality Weekly Report about the limited effectiveness of vaccines. I would like to point out that the information that was sent to us was from March 12th, 2021. And I have reviewed that information, and I have also reviewed the fact that the CDC has updated their guidelines as recently as December 6th with much more information, many more studies. And masks are unequivocally an important tool. They're not an isolated tool, but an important tool in fighting the spread of COVID. In fact, for scientific analysis, it's very important to have controlled circumstances, and controlled circumstances are very hard to come by in the middle of a pandemic. However, we do have information from an outbreak in a contained environment, which is unfortunately a perfect laboratory example. And that was an outbreak on an aircraft carrier, and wearing of a face covering in that instance was associated with a 70% reduction in the risk of infection with COVID-19. Masks have also been proven to be safe, and I won't go into the details here, but they can be found on the CDC website. Therefore, I am compelled to put forward the following motion to the Board of Health, that we urge the Board of Aldermen to implement a mask mandate and to do so without delay, given the impending holidays, even if that means an emergency meeting. This mandate should include the wearing of indoor masks in all settings, including in vaccinated persons, due to the highly infectious and transmissible nature of the Delta and Omicron variants, as well as the waning of the protection. For eating and drinking establishments, it's recommended for the safety of their staff, preservation of staffing, and the safety of patrons that masks be required except when people are actively eating or drinking. All indoor businesses should review and update their ventilation, their capacity, and their social distancing, all in an effort to spread the limit of COVID-19 and to bend this alarming curve. Masks should be worn outdoors when social distancing cannot be maintained. Individuals who cannot wear masks due to age or health issues should be encouraged to avoid indoor environments, crowded outdoor environments, and or high-risk environments unless they can wear masks for short periods of time, which the vast majority of individuals are able to do. The above should be implemented with accommodations for workers with documented medical disabilities leading to an inability to wear masks. And these recommendations should remain in place until such time that the level of community transmission is no longer substantial, as determined by the well-established metrics that Director Bagley and the public health team have been citing, and that these be held in place until the community spread metrics are no longer at a substantial level for a minimum of 2 consecutive weeks, because that's how the science is, as I quoted, they look for in a 2-week rolling average. Notwithstanding that the Board of Health and the Board of Aldermen may reconsider these issues at such time as the science of transmission and the level of protection from any combination of treatments, vaccines, and changes in the variants of the virus occur. And I look forward to Dr. Storis and Dr. Spaghetti, your comments on these framing remarks and the motion, which I guess we need a second and then discussion, if you are so inclined.
I second.
Thank you. The motion has been seconded. I'd like to see it maybe cleaned up or be more to the point, but I think it's basically a good motion. I'd like, Doctor, if you have any discussion to move forward with that.
No, I think, Stephanie, I think you did a great job in summarizing the highlights as always. I think your accommodations for the restaurants and other locations is critical to this. We're not going to be, I still think there's going to be a segment of the population that see this as restricting their rights and everything else. But if we put that aside, not because we don't care about it, because we all do, but because we're simply coming at it from a public health protection matter. You know, Dr. Alderman, I wanted to share one quote today. Michael Calderwood is an infectious disease expert at Dartmouth, and he shared with the Dartmouth community that I just shared with the Board of Health members an email that in one comment that struck me the most, in November alone, COVID-19 is now the 3rd leading cause of death in the United States, second only to heart disease and cancer. So in a short period of 18 months, we've gone from 0 to 60, you know, in a very fast, infectious way. And I think this, again, short-term mandate that we're proposing is critical with the time period that we're in. We're all going to be indoors. We're all going to be celebrating. It's not going to be forever, and we'll continue to reassess it. But I think we have to stand up and face the music that it's time. So in terms of wordsmithing, I think we can go through that. But I think as long as we've stated our reasons for why it's happening, it's an emergency. The data is there, supported by science. We're trying to accommodate all of our citizens and have recommendations about those that medically can't wear masks, I guess, and have doctors approved indications for that. But and we have a reinstatement of our mission, which is we're going to reassess this. This is not something for eternity. And as the numbers decrease, and using that substantial risk as the critical junction here, that we meet even twice a month, like we're now doing. There's an emergency meeting today to show our constituents that we mean business on this, and we'll be keeping the pulse going. So I'm not sure if I answered your question,
No.
Chairman Doris, but I just wanted to, you know, I think if we can then go from there, I think we have a nice framework to now go forward.
The only, Stephanie, great work. The only thing I would add to it is the CDC recommendations, which are part of them are national now anyway. Public transportation in the presence of people with autoimmune situations, buses, etc. Just be added to it. It was that's the only thing that I would add.
Well, to my understanding, that's a federal requirement that on public transportation. But yes, that should be made clear, and it's clearly stated on the CDC website, and we can add that. I mean, I would just point out that.
Go ahead.
Sorry.
Teeny
bit of a delay. I would just point out that the wording of the ordinance will come from the Board of Aldermen. We make recommendations. We do not create ordinances.
This is correct, and also legal will have their hand in it too to make sure that it's up there. I would just like to kind of diverge a little bit, and I like what Chuck was saying. You know, I think we all have a high regard and need to not have government twist our arm and do things like that. But as a healthcare provider, as a father, as a person of the community, I look at our jobs as healthcare providers is not only to treat disease, but to prevent disease. It's better to prevent than to treat. But as a dad and a member of this community, I think it's our obligation as a community to help protect each other. And I think that's the reason that is the most important. And as Dr. Chuck was saying, you know, we only have 4 things in our arsenal that we can work with. Everything else at this point, we don't know. Maybe the new drugs coming in the future will make a lot of things move. But it's basically vaccination, wearing the mask, social distancing, and washing your hands frequently. And what I do when I teach and I talk to patients, I tell them, we're like castles. What do you do with castles? You put them at the top of the hill, protect them from invaders. You put a moat around them. You make them real tall so you can throw stuff at the enemy below. And that's really what we are trying to use this prevention, these things that we have to keep the public healthy. It really pains me that when I see people are sick, people have died, and now people can't even get into the hospitals because there's no room for them. We have to work together as a community to get this done. We have to be less divisive about it, and we have to move forward. That's the only things that I want to say. I want to thank the community. And last week in talking, we've heard you. One of the things you noticed that Stephanie put in, and it's not a sunset clause, but we understand that you're afraid that this is going to be there forever. We hope not, but will give us the ability to review. And the sooner we get them off, I think that's great, because that means we're healthy again. There's less of a chance of people getting hurt. I'd like to
Tony,
comment. Yes, ma'am.
Tony, so I know that this is not a meeting for public comment, but our aldermanic liaison, Alderman Lopez, has his hand raised. I don't know if you can see that.
Do we want that would be public or that would not be public? Public today. Sounds like public. I just don't know if that's, you know, if we do it for one, we've got to do it for everybody, type of thing.
Well, that's, I don't think so. I think it's not a matter of, you know, an open forum, but my understanding is Alderman Lopez is an appointed member of the Board of Health as the liaison from the Board of Aldermen, and Alderman Klee is confirming that by a shaking of the head that this would not be public comment. This would be the aldermanic liaison to the Board of Health would be allowed to speak. Alderman Klee, could you clarify that in audio so that others could hear that?
Alderman Lopez is your liaison, and he is to give direction and to bring message to the Board of Aldermen. So if he has a question, I would strongly suggest that you let him speak and so on. Alderman Lopez, I apologize for speaking over you, but I think it's important for you to hear from him.
Okay, thank you. I appreciate the, Tom, you have to mute yourself.
Yeah, so I was just waiting for you guys to deliberate. So I recognize that this is deliberation specifically among the healthcare professionals on the Board of Health to advise the board. But as Alderman Clee pointed out, one of us is going to have to be the ones who originates the legislation and the city ordinance. Legal will review it to make sure that we're not proposing anything that is, not consistent with New Hampshire Constitution or our charter. But we are also going to run into the logistical time frame of gathering the aldermen, even for an emergency meeting, during a time where last night, basically, they all said goodbye for the holidays. We're going to need to have a special meeting, and we're going to have also likely, in order for this to pass within a reasonable time frame, a second reading. We won't be able to have support from the other aldermen to override our normal rules in order to have a second reading if we aren't able to make the case that this is urgent. And so while I'm taking notes on what you're saying, with legal, the legislation, and I trust Director Bagley will probably also communicate with them to make sure that it gets quickly written in a way that is accurate to what you're about to agree to. We also need to make sure that you're able to represent yourselves in an effective manner in that meeting in order to educate the aldermen who will be coming at this from different perspectives and will be weighing different priorities. We all remember what happened last year with the curfew. And I think it would be important to request a joint convention where you're able to directly interact with the aldermen, answer questions, make their case, and advise them directly while the legislation is happening. Otherwise, we could start amending sections of it that are essential while leaving parts of it that are useless, or we could end up tabling it out of confusion in the short term.
Thank you, Tom. Okay. I think the best thing we can do is let the legislative people do the legislative things and let's concentrate on our recommendation. Right. Agreed, Stephanie?
Yes.
Okay. So is there any other discussion or further discussion or amendments, add-ons that anybody would like to bring forward? Seeing none, I'd like to call the motion as written by Stephanie, but we understand that it will be amended henceforth. Those in favor?
Aye.
Unanimous? Thank you for your deliberations, your long hours of research, and your sage advice. I'm looking to end the meeting. Your motion to end the meeting? Looking for a
So
second?
moved.
Meeting is closed. Thank you very much.